tell you what, I have here in the studio a very interesting site. So we're here to demonstrate to you as well how you can keep your hands washed and how you can keep yourself safe. Yeah. I have two pretty women here who will help me to do that. But I still have some of your messages. Let me see if I can take a couple, and then we'll go on to do hand washing. This one says, Gifty, all that you've said in the video, you've seen in the video is not funny. You can attribute their attitude to the mode of delivering their precautionary information by health authorities churned out. I'm not sure if I remember, I understand that, but I think you're trying to say that the people are there because of how information is trickling down to them. You think they are alarmed somehow. He says they created panic situations rather than reassuring people. Okay, they made it appear as though hand sanitizers are the cure to coronavirus. The fact is, if we can wash our hands frequently, we don't necessarily need hand sanitizers. And I see that you agree with what she's saying. So at this point, who are we to blame? I mean, she's blaming health authorities. He says the way they put information out there, it's making it look as if sanitizers are a cure. But it is a part of it. We can't run away from that. So what do we do in such a situation?
What do we do?
We just leave it at that.
Okay. Well, I won't blame health authorities for the information we are putting out there, because the information needs to be out there.
Okay.
Imagine if nobody spoke about coronavirus and you woke up one morning and you had a flu and they told you you have a novel virus that there's presently no cure for, but you'll be fine. You blame the health authorities that this information was not out there.
So you knew and you didn't tell us.
Exactly.
Okay.
But I think it's the way it's being presented, like she's saying. I mean, and I think the message needs to be emphasized on that there are far more cases that have recovered than have died.
Right.
So we just need to reassure people that they will be fine.
So a lot more people have recovered than the number of people who have died. And coronavirus cannot be cured by sanitizers, but it can help you stay away from the virus. Now, I take this final question and then we start with our demonstration. He says, I'm following you closely, listening to the pharmacist. Then I think the best preventive measures are, he numbers them: 1, frequent washing of hands thoroughly; 2, not touching faces; 3, keeping distance from infected people; and lastly, prayer. We'll do the first one on your list, which is hand washing. And I have Mamie Senior Mitchell Thompson join us in the studio. What are you here for?
So I'm here to help us, wash our hands thoroughly.
Okay.
People wash their hands, but they don't really do it well.
Okay.
So we are here to take us through the process.
The process of hand washing.
Yeah.
I hope that you tell us when she's doing shakara with the process.
So,
okay.
Yeah, so
if you're at home, by the way, you can get your own water, your bottle of soap, or if it's a tablet, you can get your sanitizer so that you follow us, okay? And whilst you're doing that, you can take a video of it and then post it on Facebook, tag us, JoyNews. You can tag Adom, you can tag any of our multimedia platforms with your hand washing, challenge video, okay? So let's start the hand washing challenge.
Yeah, so we have here a bowl, a jug full of water. We have disposable paper or tissue, and then liquid soap, and then we have a sanitizer.
Okay.
So because we are not in normal times, we need to have running water. Ideally, it should be running water, but because we don't have a tap, we're going to use a jug.
Okay.
So what we do is, first of all, we take...
Do you want Doc to help you with the water?
Yeah, Doc can help me with that. So we first of all wet our palms with the water a little, just a little there. Thank you. And then you realize that with the soap, because you're not the only person using it.
Okay, so assuming that you are in the public washroom.
Public washroom. Either use your wrist this way, or use your elbow to get enough soap into your palm.
All right.
And then you rub it together.
Okay.
And then as you rub it together, it foams up. Yes, so you're rubbing your palm together, and then gradually work it into the spaces within your fingers. Yeah, you wash it this way, and then you work it through to your thumb area. Yeah, because you don't know where your hands have been and what you've picked up. And so you do this, and then you go to the back of your hands, and then you do this as well. You rub behind and do that with your other hand. So that all the debts, wherever you've been, you mistakenly touched, you don't even know. Yeah, you do that. And then you also do this. you are rubbing the back of your fingers.
Okay.
Yeah.
For those of us who have long fingernails, sometimes long artificial fingernails. How do we manage our?
So with
that
with the running water, you can put your hands or your fingers, your nails directly under the running water.
Okay.
And then
so let's finish with the normal natural fingers. And then when we finish, we'll try
that one. So with this, and don't forget to also rinse your wrist.
Okay.
Because you don't know where that has been. So can you please pour?
Okay.
So
then the running water.
Yeah, running water. You wash and realize
so we
that
don't run out,
please,
because we don't have water in a lot of places in Ghana.
Yeah. So as much as possible, you wash all the dirt.
Okay.
Yeah.
Wow.
And then you take your paper tissue. Enough. You dab.
Okay. Why is it so special to dab?
Yes, so that you know. The moisture is good for your skin.
Okay.
Yeah, so you're not taking everything off your skin, so that the skin can retain some of the moisture from the water.
Okay.
And then, very importantly, you dispose it off in a bin.
Okay.
Yeah, somewhere that wouldn't be exposed to the environment.
Okay.
And so we have a bin here somewhere. We put it in, and then that's it.
Okay.
So you asked about those with long nails.
Long nails, like dog hair,
like
myself.
So with that. If you do not have running water in a bowl like this, what you can do is you can do this.
Okay, so sort of scrub the bowl with your fingers.
Yeah, tumble your nails in the water, and then you rinse it with the water that is running. If you have a bowl, if not, you put your fingers under the running water.
We can try the running water again.
Yeah, can you please help me with that? So. With I don't have long nails. Or Doc, we can use yours as an example. Yes.
Okay.
So I will show you how I do it.
Okay, let's go for it.
So what I do is I put my finger, my thumb, and I wash each one individually.
Under the running water.
Like that.
Yeah.
So people are screaming that the water will get finished. But so this is for those with long nails.
Yeah, with long
artificial nails.
Yes. Yeah. So when you do this, the dirt comes out.
Okay.
Yeah. So like
put
that.
the fingernails directly under the running water.
And sometimes what I also do.
And if you don't have running water,
you can. Hit it against them and swish it in the water. Otherwise, when the running water is coming, sometimes the how they call it, the force is not that strong. Or if you can make it, the force is strong, you just place your thumb so that it splashes like a spray. Yeah, so that the force can remove the dirt under the nail. Yeah, so this is how we wash our hands. You have to do this every time. I mean, regularly. Get your fingers or your hands washed in this time of COVID-19.
Okay, someone sent a picture and is asking if I can use these hand sanitizers, but I've not downloaded what you sent. What I can say though is that, like you've seen Mami Esi done, if you don't have sanitizers, you can wash your hand. This process, go through this process as many times as you can, as possible.
As you have water, wherever you have access to water easily, or even so. I mean, some people can even take a bottle of soap to the office, wherever you are. You can have, and in place of the liquid soap, you can use bar soap, toilet soap, or medicated soap. Wherever you are, you have access to it. Some people wash their hands, and at the end of the day, they take a little of the hand sanitizers, and then you smear it.
Some too.
Don't wash their hands.
Yes, those with long nails are also
and then you just all over your fingers. Get it done right. And then you're good to go.
You're good to go.
Yeah.
You're good to go. Well, I still have them in the studio. Let's continue with our chats here. Someone sent about the sanitizers that you can prepare at home. Someone sent this. He says you can prepare sanitizers locally. Here's what you need. 1, rubbing alcohol. 2, glycerin. 3, hydrogen peroxide. I don't know what hydrogen peroxide is. 4, aloe vera gel. He says, my name is Daniel and I have tried it myself. Aloe vera is to make it thick and slippery when rubbing hands. It is simple to measure. And I remember you said that you don't know how to measure.
The quantities, he hasn't stated what quantities you need. And the alcohol, you need a specific percentage. It's not just alcohol. It's not just glycerin. They are in quantities, specific quantities that you should use. So you need to watch that.
Watch that again.
Actually effective.
Okay. Says, good afternoon. The way people are rushing for hand sanitizers is not the best because we are already in danger. So what is the mad rush? It's not any best preventive so far, because if one is already infected among them, then they're all going to be quarantined. Now that is if we will be able to know that any of them has been infected at all in the first place. He says the government should distribute hand sanitizers for free. Well, the government said it is not doing that. You should take yourself, your health, responsible for your own health. This one says, fear is said to be capable of defeating you before you get started. Fear and panic is more dangerous than the virus itself. I think we need to calm down, even as we do our best. Thanks, JoyNews, from Samuel Buama in St. Ambrose College of Education, Doma, Nkrumah. Okay, and I do have a release that's coming from the Center for Plant Medicine Research. It says alcohol bitters, not treatment for COVID-19. And I just read for you quickly what it says. Following the outbreak of COVID-19, well, the usual preamble, as you know, it says CPMR wishes to make it known that no herbal bitters or local gin could be a viable substitute for hand rubbing. This is due to the fact that, one, for a sanitizer to be effective in ridding the hands of coronavirus, sanitizers must have 60 to 95% alcohol by volume, and that alcohol content for bitters on the market is often less than 45%. I think that Doc mentioned that right now. Says that clearly such bitters and their alcohol contents are inadequate as sterilizing measure against COVID-19. CPMR also wishes to place on record that no known medicinal plant or herbal product or local gin has yet been proven to be efficacious against COVID-19. As you know, it's a novel virus. It is still being researched. As a research center for excellence, however, we are engaging with our various partners and stakeholders, including the Ministry of Health and traditional medicine practitioners, to explore research opportunities to fight against COVID-19 using herbal medicine. And I'd like to take your thoughts on that, how we can put together our strength when it comes to herbal medicine to deal with this. When I finish reading this, it says that these are guidelines. It's providing, one, frequent washing of hands, and we can't say this enough, with soap and under running water, the use of alcohol-based sanitizers, cover your cough with a bend of the elbow or tissue paper. Again, people have raised questions about the elbow. Maintaining a distance of at least 1 meter from people coughing or sneezing, regular physical activities, regular intake of water, and lastly, ensuring personal hygiene. So, Doc, I'm just interested in your thoughts about herbal medicine and how Ghana, I mean, we do a lot of that here in Ghana. Do you see from where you stand and from what people around you have said that we will be able to explore that?
Well, it's about the research. Once we have the backing for research, and the research is performed on the COVID-19 and there's results, I mean, why not? But the problem is that not a lot of research backs the claims of these herbal practitioners, and so we are not able to trust their word. So once we can have more research facilities coming up, more support, more funding for research, and we can prove that these herbal medications actually do work, I mean, we can. But I think one thing I didn't mention was that the COVID-19 is mostly, it's the immune system that actually fights the COVID-19. So it's very important that we give our immune system enough support. So we're talking about vitamins and minerals. There are a lot of immune supplements on the market. Just enter your pharmacy, tell them you want something to help you support your immune system. Vitamin C is a very good one. You can take it once a day. The effervescent 1000 milligram ones, you take one a day, and you be sure that you'll be able to fight the COVID-19 if it's to come your way.
I hope that works. What about coughing in the elbow? That's what a lot of people are doing right now. People are actually, you know, elbowing people in place of handshakes. I've heard people say that it's not safe either, because if you cough into your elbow and the same elbow you know touch somebody with it, or at a point you need to touch your clothes, you know, that
it's on. How often do you touch this part of your hand?
Well, it could be often,
but you use your palm far more.
Yeah.
Would you prefer?
So that's why the concentration is in the palm.
Exactly. So we are talking about the inner part of it. This is the elbow.
Yeah.
This is the inner part of the elbow. So the direction is to cough either here or on your sleeve. on the sleeve.
Okay.
Not, so we are shaking people this way, not this way.
What if you give someone a hug?
A hug, it goes on
but
the
we're not
back
doing
of their
hugs in
clothes.
Corona, please.
Exactly.
We're not doing hugs in
Exactly.
Corona.
And that's why we're advising that you wash your hands as often as possible.
Right. All right. So I'm going to take a no, I won't take a break. Do you want to say something?
Yes. One more thing. So those who use the bowl, after they're done, they should empty the contents of the bowl so that the next person can use the water. Nobody should repeat after you have used the
That's
bowl.
if you're not using a hand basin, a normal hand basin in a washroom.
Yeah.
Oh, and also when you're closing the tap, you have to use the tissue to close it. I think it's something we didn't mention yet.
Okay, so you open the tap, you close the tap with the tissue.